I'm happy to welcome everyone to the Faculty Academic Staff Board here at UWEC. This is our first talk of the semester, and I'm delighted to introduce today's speaker, who will talk about one of our amazing domestic intercultural immersion experiences that are available to all of our UWEC students. My name is Erica Benson. I'm the director of the Office of Research and Sponsored Programs. And it is my pleasure to introduce Dr. Schiller, who is an advanced practice nurse prescriber, a certified nurse practitioner, as well as a board certified nurse practitioner. She is an associate professor, graduate programs director, and co-chair in the Department of Diversity and Development. He has a special interest in rural and agricultural health with a history in rural family practice for over 20 years. She's participated in the domestic cultural immersion since 2011. Serves as the president of the board of directors of the Chippewa Valley Free Clinic. So before I turn things over to Dr. Schiller, I'll note that we'll have some time after the talk for questions. So please, this is your assignment. Please be thinking of some questions that you'd like to ask. And for our remote viewers, we encourage you to ask questions as well. Please use the Q&A function at the bottom of your screen. And our wonderful graduate assistant, Matt, will read questions out. Dr. Schiller, again, I just want to remind you, if we have questions from the audience, if you could just give a brief summary of those questions for the benefit of our online viewers, that would be very much appreciated. So please join me in giving a warm welcome. Dr. Schiller.
Everybody, familiar faces today. So today our talk is titled Alumni Perspective on Cultural Competence after a Rural Farm. So a little bit about me. She just gave my intro. I know you guys all love my fair hair. And I was the last one to wear the white outfit. But I put this up just because kind of like people are sometimes, why are you interested in agriculture? My parents were first off the farm. I grew up in a suburban area near Milwaukee. Was a diploma grad. Worked as we keep care nurse mostly in here and here to a hospital in the city. And even there, all the time, I would notice the injuries when farmers were flighted in with severe head injuries and how that affected the family. So just, you know, in the ICU, we treat the family just as much as the patient, and it was devastating. I then went back to school to get a bachelor's degree. Up at the city, was in rural practice for a long time, and there my patients were all farmers or farm workers. So really started to get to know some of that culture around there, and I think some of the just accepted risk. Like, so risk was just normalized in agriculture. And then in trying to develop a program to address farmers and farm families, I ended up feeling that I needed a tweet, then moved up here and moved to my husband's family farm for 170 years. Did I do that for 2 years, 17 years? This is just a little background about why this kind of happens. So if you look, the number of farms is going down, but the size of farms is going up. The amount of milk produced is going up. So what happened is there wasn't enough workers for these large family farms, so there's been an influx of immigrant workers. And in fact, it's estimated right now about 70% of the area. What's also interesting is that these workers face many barriers to healthcare, which include language, transportation, cultural issues, and agriculture remains the most dangerous occupation in the United States. So it's more dangerous, like you think mining's dangerous, farming's more dangerous, and you don't bring your kids to the mine. So that's another. So we developed a partnership with Buffalo and Putnam counties, along with Chippewa Valley Free Clinic, Fuentes, and Bridges for profit. He worked on, this is funded by a domestic version. It is embedded within a senior level clinical course for community health and leadership. And we've been running it since May of 2011 through May of 2024. See 21 farms. This semester we started with 3, 182 nursing students. Very proud of that. We've seen 176, see about 20 different semester. About 43% of those have been seen 4 or more times, so there is we are able to follow up with workers. About 78% are Hispanic, and most of them are male. So that's just some of the demographics. So this research project, whom I worked with Jeanette Olson and Jack McLeod, I'm very, very fortunate to have done that. Began in 2019, received an ORSP grant to do some surveys of alumni. My question was, and we'll talk about this on the next slide, I do a self-reflection that they do at the end of the semester. So I see, okay, this has made a difference. They enjoyed it. It changed their worldview, but do they carry it with them? That was what I was thinking. So COVID came. That kind of stopped everything, and I put the surveys that I had collected in a drawer. And one day I was talking to Matt and said, I'd really like to do something. Like, let's do it. And I have a student that would do it too. We did it. So that was great. We did receive some ORS funding for that initial student involvement. And then Jack was part of the Google Fellowship. It's been great working with them. We just had our publication accepted in June. So these are my 2 research questions. Does participation in a rural domestic intercultural immersion increase students' perception of cultural competence? And does cultural competence translate into behavior in nursing care? So when we looked at the literature, we really did find evidence that immersions increase cultural competence. What we did find also is there's not a lot on domestic immersion. There's a lot on international immersion, but not much or anything that we could find on domestic. The other thing in the literature that we found is there's really hardly no agricultural health education within nursing care. So looking at AANC and some other definitions, cultural competence is recognized as evolving developmental process and consistent with strategy policy. So we use a theme of cultural competence that viewed as an evolutionary concept. And what she found was that in developing cultural competence, there's kind of phases that people go through. The first is awareness, and that's a knowledge of cultural similarities and differences in ourselves and in others. And then attitudes, where kind of sensitivity and openness and acceptance occurs. And then finally, behavior, in which actual care is provided. Campina, the coach, also mirrors those subjects. And it's interesting because there's been a lot of conversation in the literature lately related to cultural humility or cultural competence. And the question really is, you never really get cultural competence, and it requires cultural humility. What Campina, a coach, kind of said is it's like a synergistic work in a process that doesn't, we all know that from our own. So our design in sample, we use a qualitative descriptive design. We had a written narrative of community and electronic survey of BSN alumni. That was a Qualtrics survey. We looked through emails and we were able to obtain 86 calls from 99 students who completed the immersion. We used alumni survey data. We got 37 who responded. Seven of them ended up being excluded due to missing response. So we used a Qualtrics survey. That survey was developed by myself and students who had been enrolled in this clinical and developed and was sent out, and data was collected, and then, like I said, it was back in my door. So the questions we asked was how the rural farms clinical impacted their cultural competence as it related to the population, rural living, and agriculture. We also asked a question about public health, but for the purpose of this search, we just used those for free. So the analysis we did, we used descriptive statistics for the demographics that we collected. We got written responses to open-ended survey questions, and they were analyzed using static analysis. It was first independently reviewed by Jeanette and myself, and then we sat and looked at it together. So as you see above, there was kind of some sticky note stuff, some Excel stuff, and then we finally put the data into Atlas TI. And Atlas TI is a qualitative software that allows you to, if any of you have done qualitative research, you can end up having a million different colors all over a table and you're moving them around and it feels really big. But what we did is we put it all in Atlas TI and then we can move it around. And it was really fun. You could connect like this causes this, or this is a part of this to try and get what the picture is. So we had lots of discussions. We visualized the data in many different ways, and kind of sat down at the table and talked about it. These are our demographics. They're pretty typical of nursing school demographics. We have mostly female. There's a nicer spread of those. I was happy to see some that have been in practice 5 to 10 years. So responding for thinking it was important. Level of Spanish education, initially when we started this program, only allowed Spanish minors to take. So we had fewer students, and then we ended up being able to have interpreters with us. So we kind of opened it up. So we had some Spanish speaking and some non-Spanish. And that was really a good thing, I think. That what was really special about it is it really made me realize don't our nurses as well as we should how to use because it's a skill that it's really good for them to learn. So that's been looking where they are. Most of them are practicing in an urban area. Most of them are practicing. So this is my Atlas QI network. So it does get kind of swimmy, but it's really helpful because you can move it around and you can group things. And if you're not sure, you can see how some things are linked down there and linked back up. What it really showed us is how gaining cultural competence is really a trajectory, and it is kind of, although we do some of these things in some way, it does grow over. So our results, our thematic analysis revealed the 3 themes consistent with Dashiell's dimension of awareness, attitude, and again, the responses implied that repressive nature of the theme. So one of the things that kind of jumped out is have to first have an encounter. You have to first be exposed in order to be aware. And then once you're aware, your attitude can change, so your empathy comes into it, and then your self. So for example, be able to educate or provide advocacy. So these are the 3 main themes that came up. Awareness or exposure. Heard a lot of students say this was eye-opening, was in what we heard, and better understanding. The students, a lot of them were not aware that these, like, of these cultures, not aware of culture or rural culture or the So 3 sub things I came up, which included cultural preferences and values, rural urban resource disparities, and health and safety. And this all makes sense to us as we went through it, and we're able to connect those. Here's a few quotes of the students. Let's see, I grew up in a large city, so this clinic will also help me to see the rural culture and the way they view healthcare and better understanding of the difficulties. I didn't realize how dangerous the jobs can be. The different sort of things that like, oh, this exists. Attitudes, it completely renovated my world. Comments. I feel it gave me more empathy toward individuals whose backgrounds that themselves better understand where they come from. These are just a few pictures of actually the workers' families back in Mexico. We do extensively learn about where the workers are from. I love this picture down in the corner here. If you look at this right there, it's a video and sweatshirt. So it is interesting that both cultures are really interesting. When I was in Veracruz a couple of times, I even saw a Duran City truck. Somebody bought a Duran City pickup truck and drove it back to Mexico. And then I City Bayo sweatshirts all the time. So that's just when we looked at behavior, 3 themes were identified: adaptation, care, communication, and education. I'm more aware to ask patients what hearing protection, eye protection, etc. they use when I know they have a job. So asking about PPE that they have never thought of doing before. One student said, I work in a PACU department, often send the migrant farm workers home on the same day. We have surgeries and participating in this clinical. I often take into consideration difficult getting to a hospital. So they're taking what they learned and they're actually putting it in. Communication was big, as well as education. One quote in education, they use extra time with the patient to teach them about healthy eating or other healthy habits because I know they have more limited resources. And I really like that last quote, the experience also positions for advocacy. I can now educate individuals within the rural culture on realities of Latino workers versus stereotypes. I thought that statement was, and all of us thought that statement was important because not only are they educating patients, they're educating other nurses, other providers. So the conclusions, we felt that the clinical increase nursing students' perceptions of cultural competence as evidenced by awareness, attitudes, and behavior. New awareness and attitudes translated to culturally responsive behaviors. The other thing is that this is really an affordable strategy to work on cultural humility. It also is an opportunity to expand clinical opportunities. We all know in nursing, especially, we have many challenges with facing students, and we have technical tools as well. And also the ability to prepare future nursing workforce to advance health. Strengths and weaknesses, we had a good response rate. We had rich information with specific examples. It was a small sample size. There's just one study site, and it may result in typing burden, as we found from those 7 people that did not respond, because they were just very open-ended. Lessons learned, don't procrastinate, just get it done. It's okay to reach out for help from your colleagues. It was really helpful for me to work with Jeanette, and that brought a great student perspective in to analyze the data and have rich discussions regarding meaning conclusions. And I guess it's okay to agree. There were times like, where should this go? we would agree or disagree, and but be able to come to a conclusion. So that's good. I guess before I go on to the next step, Jack, do you have anything to say about your experience?
I thought it was very, it was a new experience for me completely because I've never done like real like research, you know. I always look at these like case studies or whatever that the teachers assign me. But doing something completely new was it was really fun because I got to like kind of dissect all this raw data and it was it was really eye opening for me too because I got to learn about this whole new culture that I didn't know as well. So it was a very good learning experience for me.
Did that?
Well, it's an honor to have been invited to come along to close out this project, so I really appreciate that opportunity to collaborate with us. But I also just want to highlight what a wonderful study this was to be able to look at what is translated from educational setting into practice. There is far too little in the literature that shows what actually makes it into professional practice, and so I applaud Lisa for doing the study, and I hope others will be inspired.
So our next steps, we're continuing to run this immersion, and one of you have that we really want to do. My class is here too, so that is great. So we have lots of other data in our research that we've been collecting, identified data. We have lots of questions that we really hope to that. And hoping that we can continue to incorporate occupational health and cultural competency in the curriculum through community engagement. Do that in other ways as well. So there could be different political opportunities. We had a Weir Cruise faculty-led international immersion experience approved for next January, where we will be bringing some Spanish language, some nursing students, and some LAS students. We're going to start with some farm experiences, so maybe students that are in the 428 clinical, and then we're going to provide those opportunities for those LAS and Spanish students as well. Then we're going to bring them to Veracruz to meet their families, as well as some of the workers that have been here in the States. Then we're going to go back and we're going to have a fiesta with the workers that are here to be able to bring pictures and talk about the student experience meeting their family. So I'm super excited about that. Very good. I'll take questions. Yes.
Dr. Schiller, how will you use what you've learned from this, going forward with your current class that you have now and encouraging others to go into your 428? Because it is an application. You have to want to do this clinical. So how will you broaden this? How will you market it?
Oh, that's a good question. So Krista just asked how I'm going to bring other students into this, how I would market. Well, I think the best marketing I have is right in this room, to be honest with you. And it's funny, we were talking today with some students who were enrolled in this last year, and they were saying, well, I'm in here just because I heard it was a great, so I think just making sure that it's opportunity. Well, making sure that students know the opportunity is available, even if they're not Spanish speaking. And I think there's other things more clinical like this. It doesn't have to be exactly the same, but we have other communities within Eau Claire, within an hour of.
Thank you for very informative, and I was struck by your literature search that there was, my understanding, no evidence for domestic. So it makes me question what are the possibilities of replicating this type of model within our own state, but also beyond.
Yeah, so, Dean Abbott Anderson asked me what other opportunities there may be to replicate a program like this, either within Wisconsin. I can tell you, I've done a lot of work. I've worked with Stevens Point. I've worked with Madison, their veterinary college, that they were looking at doing something similar with human doctors and other places. And it has been replicated a little bit further. COVID was a huge issue. There were a lot of these talks that had launched a couple of programs and gotten some funding for a couple of programs in the Dane County area that actually were funding. And then it just, and I think, but I honestly think there are other populations in our community that similar to work, other rural communities, and we're doing a lot of enforcement as well with other rural. We've been doing some work with plain communities. I think there's lots of opportunity. Yeah.
As you further, go about this clinical, do you intend to reach other farms? Like, I know we've returned to a lot of the same farms, but do you intend to grow kind of that list of farms, in different counties or different areas, building more partnerships with other counties?
Yeah, so Allison just asked if we were looking at growing the number of farms that we do. We pretty much maxed out Pepin and Buffalo County. They haven't really been there, but they're not real big. And we have most of the large farms there. I think we're working on getting Dunn County involved, and we may be able to do that for this semester. So I think there's a couple things at work here. One is public health departments, rural public health departments are strapped. They maybe have one, maybe two nurses. And so for them to dedicate that time to be able to go that one day a week with us is a big ask. It's not possible, but there's ways to do it. And I think other communities have been programs like the Rural Health Initiative on the eastern part of the state of Shawnee, where they've been able to successfully kind of replicate what we do, but not with nurses. I think there's a very possibility. I think it'd be great. I think right now, the political climate makes it a little difficult to agree.
Shirley, could you tell us a little bit more about what a day looks like in the farms?
Sure, I would love to. So I get up and go to Enterprise, rent a car, and rent a 15-passenger van. While Delete is at the School of Nursing, and she's got a big dolly. She loads up with all of our supplies. We have them in totes and just ready to go. So then I pull in, and the students put all the supplies in the big van and drive to First Farm. We usually go to 1 to 3 farms. And so the students put everything in, and we set up our clinic. We usually have an area we do immunization area. We do cholesterol screening, glucose screening, so diabetes screening, and do hemoglobin A1C screening, so we find the elevated sugar, blood pressure screening, alcohol, tobacco use, BMI, weight, and then tuberculosis screening we do in the state of Wisconsin. So their TB dispensary covers the cost of that. We do a T-spot, which is the IGRA, it's a blood draw, basically, and it's nice because you don't have to do 2 tests. So then we pack everything up and another farm. We've had booties on our feet, so I'll take all our booties off and put them in a bag, and then we go to the next farm and do it all over again. Race back to Eau Claire so we can get the bags by 5 o'clock. All over again.
First, thank you for the presentation. I think it all of us energized to work with these clients this semester and see how it all translates for us in the future. And then second, my question is, how do you feel like we could integrate agricultural health and safety into our current curriculum? Like, for example, like a simulation with an injured farm worker or, interpretation services. I just came to mind, but
Yeah, thanks. I think, she asked how we can integrate agricultural health and safety, some of these things into our regular curriculum. I couldn't agree with you more. I think we can fit it in with, public health is really important because if we talk about occupational health, those health, I think as far as use of interpretation, simulation is a great opportunity to do that. And hopefully our Spanish language colleagues are listening in and going, oh, that would be a really good idea. So, I think that's really important because I have learned students through the years, when I'm saying, no, don't look at the interpreter, look at your patient, right? And that if you're talking to your patient, you're not talking, pretend the interpreter's like not there, but it's a human nature thing to do, and the client feels the same way, but really to show that parent presence. So partially, maybe, that's a great answer, right? I think, I believe it as, if I thought there was a difference in people that had Spanish language skills versus those who don't. Well, I think there's a difference in students who have rural culture skills than those who don't, and there's a difference in students that have agricultural skills and those that don't, as well as those who have Spanish skills and those that don't. The beauty happens of all of those things together, right? And we all can learn from different cultures, and sometimes we don't think of rural culture as being a different culture. It's kind of a little bit further away, but it really is. Its implications for public health.
First, I just want to say thank you and fellow colleagues and students for keeping the program going for so long. I mean, all the hard and great work that you do and all that, and for exposing most of us who are white, right, to a different population. Sadly, there's a lot of resistance that's still in our society, particularly very white Western Wisconsin region here. So thank you for that. But what I wanted to ask, what was most striking, perhaps surprising, about what you found in the results, maybe the thing, and whatever that might have been, how might that impact you? Of course, the immersion, both or neither.
So, thank you. So Jeff asked me what was most striking in the results of our analysis. I think things that really hit home with me was that confidence in their behavior, like this is the right thing, and that advocacy was important. So just, I think what was important for me to see is it really is a true justice, and that even like as you read through some of the different responses, there were some students who had awareness, but it really didn't translate to attitudes. So maybe the attitudes, but not behaviors. You kind of went to individual classes, and just kind of thinking about how do we make that happen. But it was reassuring.
Thanks, Dr. Schiller. I have one more question. Have you ever thought about doing a research study on the impact that the students have on the farm work?
That sounds like a great idea. Kristen asked if I thought about something like doing a study of the impact that the workers. I can tell you, it's really interesting in my role at Chippewa Valley Creek. So it's made an impact on the healthcare I believe that they have received. So when in 2012 I started with 3.12 today it's 70. So that's an impact. And they're not all from the farms that we see, but I bet they know people that know people, and so being able to provide that service is great. And that's the only thing in my mind is the clinical work, because originally my feelings were like, I can't go out and excuse me, diagnose high blood pressure or hypertension. But for for elevated class now without having resources. And these are people that don't have resources. So Chippewa Valley Free Clinic.
One last question. So we really talked about some of the translatable skills from your particular clinical that could translate to other fields. You know, that working with an interpreter, getting to have exposure to other domestic. Beyond those two skills, is there any other translatable skills that you or could be appropriate?
I ask if there are any other skills that can be fitted in. Yeah, I think just some of the cultural awareness stuff that we do, so the real examination of our own personal bias and each other's biases. There's lots of discussion that we have related to our own culture, as we move forward. Like, for example, our first day, we talked about, I had students come prepared with a story about immigration. Sometimes there's this whole black and white, like, immigrants are here and then there's the US citizens, but we're really, so we went around the road, you know, and I got to tell the story of how my great grandparents came over from Russia, that they were German Russians, and Elise got to tell her story of her family's immigration to Brazil. And so we heard lots of stories, and I guess those kind of things are important where you just talk about things like that. And I think our clinical also affords the opportunity to talk about safe spaces too, and different opinions are great. Good to talk. That's kind of the skill, but it's the soft skill, but.
To end on, I would say, so let's thank Dr. Schiller for this wonderful.
And Immersion, that's starting in summer, they're going to John's Farm.
They are, indeed. You don't have to be a nursing student. If you are welcome, but this will give all UWEC students an opportunity to visit the berry farm. One of the main ones, certainly the your program has many times. And John Rosenau and Quintes Bridges are partners of UWEC. So you'll get to meet the workers, and then also the program will include a visit to Twin Cities to meet with Latinx populations there as well, and sort of connect the dots between the food that is created in Western Wisconsin and where the supply chain and how it is distributed and how it impacts all of us one way or the other. We are all interconnected.
They surely are. So this can be found on
On the Immersion's website at the moment, and we'll put some posters up around campus. So,
all right.
thank you.
Great. Thank you.
Thank you.